Corona, in this context, refers to the novel coronavirus, specifically the coronavirus responsible for the COVID-19 pandemic. Coronaviruses are a large family of viruses that can cause illness in animals and humans. The name, coronavirus, comes from the crown-like spikes that are observed on their surface under a microscope, resembling a solar corona. The COVID-19 coronavirus was first identified in December 2019 in Wuhan, China. It is officially known as SARS-CoV-2, Severe Acute Respiratory Syndrome Coronavirus 2, and belongs to the same family of viruses as the SARS-CoV virus that caused the SARS outbreak in 2002-2003. COVID-19 primarily spreads through respiratory droplets when an infected person coughs, sneezes, talks, or breathes. It can also spread by touching surfaces or objects contaminated with the virus and then touching the face, particularly the mouth, nose, or eyes. The symptoms of COVID-19 can range from mild to severe and include fever, cough, difficulty breathing, fatigue, body aches, loss of taste or smell, sore throat, and headache. In severe cases, it can lead to pneumonia and organ failure, and in some cases, it can be fatal, especially for older adults and individuals with underlying health conditions. Since its emergence, COVID-19 has spread globally, leading to a pandemic. Governments and health authorities worldwide have implemented various measures to control the spread of the virus, including social distancing, wearing face masks, frequent hand washing, testing, contact tracing, and vaccination campaigns. It's important to stay informed about the latest guidance from health authorities and follow recommended precautions to protect yourself and others from COVID-19. What if Corona lockdown never happened? If the COVID-19 lockdowns had never happened, the following scenarios could have unfolded. 1. Spread of the virus. Without lockdown measures, the spread of the virus would likely have been more rapid and extensive. 1. The lack of restrictions on movement and social interactions could have led to a higher number of infections and potentially overwhelmed healthcare systems in many regions. 2. Increased cases and deaths. The absence of lockdowns could have resulted in a greater number of COVID-19 cases and, subsequently, more severe illness and deaths. 2. The healthcare infrastructure might have been strained beyond capacity, leading to difficulties in providing adequate care to patients. 2. The absence of lockdowns would likely have resulted in a higher overall mortality rate due to the increased transmission and strain on healthcare systems. 3. Vulnerable populations, such as the elderly and those with pre-existing health conditions, would have been at a higher risk of severe illness and death. 4. Economic impact. The pandemic's impact on the economy could have been different. 4. Lockdown measures were implemented to slow down the spread of the virus, but they also resulted in significant disruptions to businesses, supply chains, and employment. 4. Without lockdowns, some economic activities might have continued more normally, but there could have been a higher risk of infections within workplaces and public spaces. 5. Strain on healthcare systems. The absence of lockdowns might have put immense pressure on healthcare systems, with a surge in hospitalizations and the need for intensive care. 5. This could have resulted in limited resources and a strain on medical staff, affecting the quality of care provided to patients. 6. Public health response. The absence of lockdowns could have influenced the public's perception and response to the pandemic. 6. Measures like social distancing, mask wearing, and hygiene practices might not have been widely adopted, leading to a higher risk of transmission and a prolonged pandemic. It's important to note that lockdown measures were implemented in response to the severity and rapid spread of COVID-19, with the aim of protecting public health and reducing the strain on healthcare systems. While the economic and social impacts of the lockdowns have been significant, they were deemed necessary to control the spread of the virus and save lives.